I'm Dr. Deanne Strobel, and I'm going to talk to you today about overactive bladder and interstitial cystitis. So in this drawing, I have done a basic drawing of the bladder here, and the kidneys up here, and the tubes that drain the kidneys, which are called the ureters. Now, urine is produced in the kidneys, and it goes through these little tubes until it reaches the bladder. Once the urine reaches the bladder, it is stored here until time to void. Here I have removed the labels so that we can see everything a little more clearly. I'm going to move everything up a little bit and zoom in so we can concentrate on what's going on in the bladder itself. What many people don't realize is that located inside the bladder, there are tiny little nerve endings that come out all along the bladder, and of course I can't really demonstrate those too accurately, but they're all throughout the bladder. There are also little bitty blood vessels that come out all along the bladder. Now these are covered up and protected by a little bitty invisible layer, and it's almost like a little layer of jelly, if you can imagine it. This invisible layer is called the glycosaminoglycan layer, and it looks like this. So you can see that this little protective layer keeps the urine, now shown in this picture, from actually coming into direct contact with the blood vessels and the nerve endings. In this picture, I've added the labels so that we can keep everything straight. So this is how things work in a normal, healthy bladder. So, as a review, so we don't forget, remember that everything is connected. So, while we were talking about the bladder, we still have to remember that everything comes from the kidneys. So, when we eat or drink anything at all, those foods and beverages are processed in the stomach and in the intestine, but most of the liquids are absorbed and end up being used to produce urine. And the chemicals that are contained in those foods and beverages are also processed through the kidney and go and are excreted in the urine. So, it really is true, you are what you eat. There are certain chemicals that, after they're processed into the urine, they come down into the bladder and actually will erode through that protective layer and get into direct contact with the blood vessels and the nerve endings. The top 3 things that cause this are carbonated beverages, caffeine, and alcohol. Once the protective layer has been disrupted in the bladder, symptoms of overactive bladder and interstitial cystitis will continue and even worsen. This layer can be completely destroyed, but the good news is it can be completely restored. There are a lot of medications on the market currently to treat these conditions, but I prefer to address them naturally first. One is because medications can have side effects, and medications are expensive. So my thought is, if we can do this naturally, it's going to be much healthier for the patient, but also a lot cheaper, and we'll have no side effects. So what's going to be my treatment preference? Mine is going to be lifestyle and dietary changes. As we remove certain items in the diet, then we will notice that this protective layer will be restored. Now, it does take a little time, but patients will usually notice a huge improvement within the first month. Now I'm going to review the top 5 things that cause this most commonly. The number 1 thing would be caffeine in coffee or tea. Now this is also in a lot of other foods and beverages. Carbonation is probably the next most common thing. So that would be fizzy or bubbly drinks, including decaffeinated or non-caffeinated sodas like Sprite or something like that. Highly acidic foods would be next on the list. This is going to include things like vinegar, vinegar-based salad dressings, pickled items, things like that. Also included in this list would be tomato-based products. And while citrus foods are healthy for you in general, they can worsen this also because of their acidic content. So this would be things like lemon and lime. And last but not least would be alcoholic beverages. So this includes wine, straight up alcohol like vodka, but also beer. Now I know what many of you are thinking. You're thinking it's going to be impossible to get rid of all of these types of foods. But I can tell you that if you just completely get rid of these items for a few weeks, the bladder will be so much better. And then you will notice that if you have something once in a while, it may not bother you. I also have a very long list of other things that could be causing problems. So what I usually like people to do is go through the list, and if they find something on the side that says usually problematic that they eat every day or drink every day, then that might be something you want to cut out. But these are the top offenders. One of the things I forgot to mention is something that's very commonly associated with making the bladder healthy, and that is cranberry. Now, cranberries or cranberry juice, cranberry tablets are healthy when you're trying to get rid of a bladder infection, but it's highly acidic. And if the bladder is already injured in that glycosaminoglycan or protective layer, then cranberry juice, cranberry tablets will actually make the symptoms worse. Now I've listed some of the symptoms of overactive bladder and interstitial cystitis. Most commonly, this condition starts and will mimic a bladder infection. So patients will have urinary frequency, meaning they'll have to go frequently to the restroom or feel like they have to go frequently. So sometimes they'll go to the bathroom and say that only a very small amount will come out. Urgency, meaning the feeling that you have to go immediately. Nocturia means voiding several times during the night. So while one time is considered fairly common or acceptable, having to go to the restroom multiple times during the night is very disruptive in sleep. Dysuria is painful voiding. Now, this condition can progress to where these symptoms are felt all of the time and can significantly interfere with your life. So if a patient is, every time they go to the mall, the first thing they do is look for all the restrooms, or the first place they go and have to go several times during a trip, that's a little bit abnormal. So other patients may say they have to stop to go to the restroom every 30 minutes or hour while on a road trip. So that becomes very disruptive. Now this can progress to where a patient will feel pelvic pain. So she will complain of pain in her lower abdomen almost all of the time and will experience pain during intercourse. So while this condition is not necessarily life-threatening, it can significantly affect the quality of life. So if someone's voiding all of the time during the night or having to void a lot during the day, they're going to be very tired. It can interfere with a job, and intimacy, many things. So the aim to get the bladder better is very important. So if lifestyle and dietary changes don't help in the first 6 to 8 weeks, then a lot of times I will prescribe medications, or I will prescribe medications also if someone is significantly affected and I want to have the medications help them while they're doing the dietary changes. Now, some people fail lifestyle and medication, and there are some surgical procedures that can be done. One of them is called the Interstitial procedure, and it is similar to a pacemaker, but instead of the wiring going to the heart to control the heart, the wiring goes in the low back to the nerve endings that control the bladder and will help modify that. So I hope that this gives you a better understanding of how the bladder works and how we can help you get better.